Every year, 1.5 million people worldwide develop myocarditis, heart muscle inflammation that strikes without warning and can kill within hours. Research reveals myocarditis causes 5 to 22% of sudden cardiac deaths in young people, yet over half show no warning signs beforehand. In a groundbreaking study of 97 sudden deaths from myocarditis, only 47% had recognizable symptoms before their fatal event. This means more than half of victims had no chest pain, no shortness of breath, no warning at all before their hearts simply stopped beating. The 2024 American College of Cardiology Expert Consensus Decision Pathway has revolutionized our understanding of myocarditis, identifying 10 critical warning signs that could mean the difference between life and death. These aren't theoretical symptoms. They're backed by cutting-edge research from institutions like Johns Hopkins, Mayo Clinic, and data from the world's largest cardiac registries. Before we dive into these life-saving signs, if you're new to our channel, welcome to a community dedicated to protecting hearts and saving lives. Don't forget to like this video and subscribe so you never miss our latest medical insights. Your journey to understanding cardiovascular health starts here, and we're honored to guide you through it. Drop a comment letting us know where you're watching from. We love connecting with our global audience who are taking charge of their heart health. Now, let's dive into the warning signs of heart inflammation, beginning with the very first one. Chest pain. Chest pain occurs in 85 to 95% of myocarditis cases, making it the most common and potentially deadly warning sign. This pain is often described as sharp, stabbing, or resembling a heart attack or pericarditis. According to the 2024 American College of Cardiology guidelines, patients with myocarditis can present with isolated chest pain that perfectly mimics an acute coronary syndrome. European Heart Journal research shows that 57.5% of patients had ST segment elevation on their electrocardiograms, identical to what appears during a heart attack. This similarity creates a dangerous situation where people might delay seeking help, thinking their symptoms will pass, or attributing them to anxiety. What makes myocarditis chest pain particularly ominous is its unpredictable nature and intensity. Unlike typical heart attack pain that might worsen with physical activity, myocarditis chest pain can strike at rest, during sleep, or with minimal exertion. The inflammation in your heart muscle creates an unstable electrical environment, and that stabbing chest pain could be your heart's desperate cry for help before it develops a life-threatening rhythm disturbance that could kill within minutes. Research consistently shows that myocarditis patients who present initially with chest pain have significantly better outcomes than those who present with more advanced symptoms, making early recognition absolutely critical. The pain often feels different from anything patients have experienced before. They describe it as a knife-like sensation that can radiate to the shoulders, neck, or jaw. Studies from major cardiac centers demonstrate that chest pain in myocarditis can be accompanied by a pericardial friction rub, a distinctive scratchy sound heard through a stethoscope as the inflamed heart rubs against its surrounding membrane. The pain may worsen when lying flat and improve when sitting forward, helping distinguish it from typical heart attack pain, though the similarity in electrocardiogram changes makes it nearly impossible for patients to differentiate without proper medical evaluation. Next, sign 2. Rapid or irregular heartbeat. Rapid or irregular heartbeat, including palpitations, rapid fluttering, or skipped beats, represents the second dangerous sign as inflammation transforms your heart's electrical system into a ticking time bomb. This may include dangerous rhythms like ventricular tachycardia. The 2024 Expert Consensus classifies patients with electrical instability, including recurrent ventricular tachycardia or advanced atrioventricular block, as having high-risk features requiring immediate specialized care at advanced heart failure centers. When inflammation attacks your heart muscle, It doesn't just affect the pumping chambers, it disrupts the specialized conduction system that coordinates every single heartbeat. Research published in Circulation: Heart failure demonstrates that QRS width greater than 120 milliseconds, atrioventricular blocks, symptomatic bradycardia or tachycardia, and ventricular arrhythmias should dramatically increase suspicion for myocarditis and suggest high-risk forms of the disease. The inflammatory process involves the conduction system in 38% of sudden death cases, meaning your heart's natural pacemaker becomes collateral damage in the inflammatory assault. These disturbances create situations where your heart may pause for several terrifying seconds or develop dangerously fast rhythms that cannot sustain adequate blood circulation. The palpitations you might feel aren't just uncomfortable sensations. They're potential harbingers of ventricular fibrillation, a chaotic rhythm that can kill within minutes. Johns Hopkins research confirms that when the heart muscle becomes inflamed, it affects the heart's electrical system, causing arrhythmias ranging from annoying palpitations to fatal rhythms. Patients often describe feeling their heart skipping beats, racing uncontrollably, or fluttering in their chest like a trapped bird. What makes these rhythm disturbances particularly dangerous in myocarditis is their complete unpredictability. They can strike without warning, even during rest or sleep. The inflammation creates areas of damaged tissue that act as electrical short circuits, disrupting the normal orderly flow of electrical impulses through the heart and potentially triggering sudden cardiac death. Next, sign 3. Shortness of breath. Shortness of breath, especially while resting or during activity, represents the third deadly warning sign, occurring in 19 to 49% of myocarditis cases. This may also involve orthopnea, which is worsening shortness of breath when lying flat. What makes this particularly dangerous is that it can progress from mild exercise intolerance to life-threatening respiratory distress within a matter of hours. When inflammation damages your heart muscle, it reduces the heart's ability to pump blood effectively, causing fluid to back up in your lungs, a condition called pulmonary edema. The 2024 American College of Cardiology guidelines specifically mention that patients can present with overlapping symptoms related to heart failure, and shortness of breath is often the very first sign that your heart is failing to meet your body's circulatory demands. Research from major cardiac registries shows that myocarditis patients may initially experience mild shortness of breath during routine activities like climbing a flight of stairs or walking short distances. However, as the inflammation progresses and damages more heart muscle, they develop orthopnea, worsening difficulty breathing when lying flat. This occurs because when you lie down, blood returns to your already failing heart more rapidly, overwhelming its compromised pumping ability and forcing fluid into the lungs. The most chilling aspect of shortness of breath in myocarditis is that it can signal the transition to fulminant myocarditis, a rapidly progressive form that can kill within days and often requires immediate mechanical circulatory support or heart transplantation within hours of presentation. Patients with myocarditis-related shortness of breath often describe feeling like they're drowning or suffocating, even when sitting completely still. The breathlessness may be accompanied by a persistent cough, especially when lying down, as fluid accumulates in the lungs. Unlike shortness of breath from lung problems, myocarditis-related breathing difficulty is often accompanied by other cardiac symptoms like chest pain or palpitations, creating a dangerous constellation of findings that should prompt immediate medical evaluation. Next, sign 4. Fatigue, weakness, exercise. Intolerance, fatigue, weakness, and exercise intolerance represent a triad of symptoms that reflects your body's desperate attempt to compensate for a failing heart. This represents a general sense of tiredness or inability to exert yourself normally. When myocarditis attacks your heart muscle, it creates a cascade of physiological changes that manifest as overwhelming fatigue, unlike anything patients have experienced before. As the heart muscle weakens from inflammation, it cannot pump blood effectively to other parts of your body, resulting in organs and tissues receiving insufficient oxygen and nutrients. This systemic oxygen debt creates the profound fatigue that many myocarditis patients describe as feeling completely drained, even after a full night's sleep. Research from the Myocarditis Foundation shows that athletes may be more attuned to minor physiological disturbances and complain of nonspecific symptoms such as fatigue, muscle aches, or exercise intolerance. However, studies of sudden cardiac death cases reveal that this exercise intolerance can be the only warning sign before catastrophic cardiac arrest occurs without further notice. The exercise intolerance component is especially critical for young athletes and physically active individuals. Research published in major cardiology journals demonstrates that exercise during active viral myocarditis may exacerbate myocardial inflammation with precipitation of malignant ventricular arrhythmias that can be immediately fatal. The fatigue isn't just your body telling you to rest. It's a protective mechanism trying to prevent you from triggering a fatal cardiac event. When your usual jog around the block suddenly feels impossible, or climbing a single flight of stairs leaves you breathless and completely exhausted, your heart may be desperately trying to communicate that inflammation has compromised its ability to support your body's metabolic demands. Many patients describe feeling like they have no energy or their battery is completely drained, and this persistent exhaustion, especially when combined with other cardiac symptoms, should never be ignored or dismissed as stress. Next, sign 5. Swelling in legs, ankles, or feet. Swelling in legs, ankles, or feet signals that your heart can no longer maintain proper fluid balance, signifying poor heart function and possible fluid retention. This represents a critical transition toward heart failure. When myocarditis damages your heart muscle, reduced pumping efficiency triggers hormonal responses your body mistakes for dehydration. As cardiac output decreases, kidneys retain sodium and water, but the weakened heart cannot pump effectively, causing tissue accumulation. Swelling typically begins in feet and ankles due to gravity, progressing upward as failure worsens. Studies show patients developing edema have significantly higher risks for mechanical support or transplantation. This represents your body's final attempt to maintain blood pressure as the heart fails. Research shows patients with heart failure signs have dramatically higher mortality rates. The swelling in myocarditis-related heart failure is typically pitting. Pressing the swollen area leaves an indentation taking seconds to fill. Swelling may be accompanied by rapid weight gain as fluid accumulates, and patients notice shoes feel tight or rings no longer fit. That ankle puffiness you attribute to salt or standing could be your heart's final warning before complete failure. Mayo Clinic research confirms this peripheral edema signifies poor heart function and fluid retention, indicating myocarditis has progressed beyond simple inflammation to actual cardiac dysfunction. What makes this swelling particularly ominous is its progression pattern documented in cardiac research. The edema can progress into the abdomen and lungs as heart failure worsens. Studies from major cardiac centers show patients who develop peripheral edema as part of their myocarditis presentation are at significantly higher risk for requiring advanced heart failure therapies, including mechanical circulatory support or heart transplantation. Research from the American College of Cardiology reveals that patients presenting with signs of heart failure, including peripheral edema, represent fulminant cases with dramatically higher mortality rates. Next, sign 6. Fainting, lightheadedness, or near-fainting episodes. Syncope indicates inadequate brain blood flow and represents an urgent warning before sudden death. Occurring in 6% of cases, its presence dramatically increases fatal outcome risks. When myocarditis inflames heart muscle, it disrupts both pumping function and electrical systems simultaneously. Studies show inflammatory processes involve conduction systems in 38% of cases, creating dangerous heart blocks where electrical signals cannot travel properly. This creates situations where your heart may pause for seconds or beat too slowly to maintain adequate blood pressure and brain perfusion. Research shows these blocks signal severe conduction system involvement requiring immediate pacemaker implantation. Studies found only 7% of sudden death victims had syncope beforehand, but it served as direct precursor occurring within days or hours of fatal arrhythmia. The fainting episode represents a preview of cardiac arrest. Your brain temporarily deprived of oxygen as your heart fails to maintain circulation. Patients describe feeling dizzy, lightheaded, or having tunnel vision before losing consciousness. That dizzy spell could be your heart's last warning before it stops beating. Next, sign 7. Heart failure or cardiogenic shock. This represents immediate life-threatening emergency where your heart cannot sustain life without intervention. The 2024 consensus identifies this as requiring immediate transfer to specialized centers with mechanical circulatory support capabilities. Cardiogenic shock occurs when inflammation severely damages muscle beyond compensation, including critically low blood pressure, lung fluid accumulation, and organ shutdown. Patients can progress from stable to requiring mechanical support within hours. Fulminant myocarditis accounts for 8% of cases, but carries disproportionately high death risk, with mortality rates exceeding 50% without immediate advanced therapies. When extensive inflammation destroys enough muscle, remaining tissue cannot compensate. Your blood pressure drops dangerously because your heart cannot generate enough force to circulate blood. Your lungs fill with fluid because blood backs up from failing left ventricle, and kidneys begin shutting down from inadequate blood flow. Research confirms patients reaching this stage often require ventricular assist devices or immediate transplantation. The presentation includes altered mental status, cool, clammy skin, weak pulse, and multi-organ failure signs, making early recognition critical for survival. Next, sign 8. Flu-like symptoms or recent viral illness. Viral symptoms precede myocarditis in 18 to 80% of cases, serving as both trigger and warning. Viruses like COVID-19, influenza, adenovirus, and Epstein-Barr can trigger cardiac inflammation. What's alarming is cardiac symptoms often appear after viral symptoms resolve, creating false security when your heart may be under immune attack. Fever occurs in 65% of cases, making it a common associated symptom, providing early clue to developing cardiac inflammation. Mayo Clinic research confirms flu-like symptoms, including headache, body aches, joint pain, fever, or sore throat, can precede or accompany myocarditis. Most people dismiss these as normal viral illness and continue regular activities, potentially exposing their inflamed heart to dangerous stresses. The viral prodrome indicates immune system overdrive. Research shows inflammatory responses persist after virus clearance, with cytokines continuing heart muscle attack. Studies found 33% of sudden death patients had flu-like symptoms within 2 weeks before fatal events. That lingering fatigue, mild fever, or general malaise after a cold might not be normal recovery. It could be your immune system launching devastating attack on your heart, with inflammatory molecules continuing to damage heart cells weeks after original virus elimination. Next, sign 9. Sudden cardiac arrest or death. The most catastrophic sign represents ultimate heart failure. Myocarditis causes 5 to 22% of sudden deaths in young populations, particularly devastating athletes. Inflammation creates unstable electrical environments perfect for ventricular fibrillation, causing immediate arrest. Ventricular fibrillation is chaotic, disorganized rhythm causing immediate cardiac arrest and death within minutes, unless emergency defibrillation is provided. A landmark study found mean death age of 19.3 years, 76% male, with 58 cases involving active individuals. Most shocking, only 47% had recognizable symptoms, meaning over half had no warning their hearts were inflamed and vulnerable. Among sudden deaths, 78% occurred at rest, including during sleep, while 22% during activity. This unpredictability makes prevention challenging, but studies show inflammatory processes frequently involve heart's electrical conduction system, suggesting electrical disturbances rather than pump failure are often final pathway to death. Italian studies demonstrate inflammatory infiltrate in fatal cases was predominantly multifocal, affecting multiple heart areas and involving critical conduction structures in over 1/3 of cases. This creates multiple potential trigger points for fatal arrhythmias, explaining why sudden death can occur even in patients seeming to recover. Next, sign 10. Long-term complications. Dilated cardiomyopathy represents chronic aftermath where permanent damage causes enlarged, weakened hearts progressing to chronic failure or requiring transplantation. Studies show 50% of cardiomyopathy patients ultimately need transplants due to progressive condition nature. Children with acute myocarditis have only 60% transplant-free survival likelihood. The progression represents one of most serious long-term consequences of heart inflammation. Research shows myocarditis and resulting cardiomyopathy are leading transplant causes in the United States, particularly in younger patients. Myocarditis can recur even after apparent recovery, with recurrence risk estimated at 10 to 15% over patients' lifetime. What's alarming is this progression's unpredictability. Even patients appearing to recover completely can develop cardiomyopathy months or years later without warning. Research using cardiac magnetic resonance imaging reveals many patients continue showing ongoing inflammation and scarring evidence even after becoming asymptomatic, suggesting disease process may be silently ongoing despite symptom absence. Scar tissue development in heart has been associated with significantly increased risk of dangerous arrhythmias, progressive heart failure, and sudden cardiac death even in patients whose initial episodes seemed mild. This makes long-term cardiac monitoring absolutely critical for anyone ever diagnosed with myocarditis, regardless of apparent recovery. Regular echocardiograms, electrocardiograms, and advanced imaging studies are necessary to detect early progressive heart damage signs before they become irreversible. These 10 dangerous signs of myocarditis represent far more than just symptoms. They are potential lifesavers when recognized and acted upon quickly. The research is absolutely clear. Myocarditis can strike anyone at any age, but it particularly affects young, seemingly healthy individuals who may have minimal or no warning before catastrophic complications occur that can end their lives within hours or days. From the chest pain that closely mimics a heart attack to the subtle fatigue that suggests early cardiac compromise. Each of these 10 signs represents your heart's desperate attempt to communicate that dangerous inflammation is threatening its ability to sustain your life. The 2024 American College of Cardiology expert consensus has revolutionized our understanding of myocarditis, emphasizing that early recognition and prompt treatment can prevent progression to life-threatening complications, including heart failure, dangerous arrhythmias, and sudden cardiac death. Whether it's the irregular heartbeats that can trigger fatal rhythms within minutes, the fluid retention that signals progressive heart failure, the exercise intolerance that warns of declining cardiac function, or the fainting episodes that indicate dangerous electrical system involvement, these symptoms demand immediate medical attention and comprehensive cardiac evaluation. The sobering reality is that myocarditis is responsible for sudden cardiac death in thousands of young people each year, many of whom had absolutely no idea their hearts were inflamed and vulnerable to fatal complications. The research consistently shows that while some cases of myocarditis resolve completely with appropriate treatment and rest, others progress relentlessly to chronic heart failure or require heart transplantation for survival. The key to survival and optimal outcomes lies in recognizing these critical warning signs early and seeking immediate, comprehensive medical evaluation before irreversible damage occurs to your heart muscle. Remember, when it comes to cardiovascular health, early intervention can literally mean the difference between complete recovery and tragic outcomes. These warning signs exist for a reason. They're your heart's way of crying out for help before it's too late. If this video was helpful in understanding these critical warning signs that could save your life or the life of someone you love, kindly type "helpful" in the comments. That feedback motivates us to continue producing more life-saving content like this. Please like this video to help others discover this vital, potentially life-saving information. Share it with your friends and family members who need to know these warning signs, and subscribe to our channel for more evidence-based health content that could literally save lives. Thank you for watching, and remember, when it comes to your heart and cardiovascular health, it's always better to be safe than sorry, and seek prompt medical evaluation when in doubt.